Hey everybody, I'm Tim Hockett. Thank you in advance for watching these little videos. I'm trying to address the forces dividing America, along with the ethical, political, and cultural underpinnings that point to causes, but also maybe even to solutions. You know, in my opinion, one of the reasons a number of Americans struggle financially in this nation, even though we have a wonderful standard of living, is that we tend to monetize almost everything. In our capitalist society, we like to put a price on things as if everything can be valued in dollars. I mean, when I was a kid, I remember TV was free, but it's not free anymore, is it? We've come to expect that in most marketplaces. Think about all your basic needs, food, clothing, utilities, water, power, garbage pickup. We're used to buying this stuff. If we have certain skills, like the ability to cook, we can get away with buying components of meals and cooking at home. But we often like to pay others to cook our meals for us, especially if it's as tasty and competes with our own ability to cook the same thing. You know, way back in the 30s and 40s of the last century, it was very common for women to buy material and make their own family's clothes. Similarly, during westward expansion, land was there for the taking or was very cheap, and men developed the skills to grow things and to build their own homes. Think about those cool homes across America that were built more than 100, maybe even 150 years ago. Over time, slowly but surely, we moved to a more consumer society wherein we've learned to buy what we want instead of, make what we want. We can argue the advantages of one over the other, I suppose, but we live in a society that behaves as if money can buy everything, including happiness and even health. A special concern to me and a key economic stressor in our society is the cost of health care. For many years in a row, inflation with regard to health care has far outstripped other costs. According to that famous consumer price index, since the year 2000, so over the last 23 or so years, the price of all consumer goods when taken together has increased about 80%. But the price for medical care, including medical services and equipment and medicines, increased so that it peaked last year at 117%. Just as importantly, the cost of health insurance, often provided by employers, is being shared by employees to a greater and greater degree. That is, employers covering people, but each individual has to share part of that in an ever-increasing manner. The net effect is that 2/3, think this through and remember it, 2/3 of bankruptcies in America are now due to heavy medical costs. Why am I bringing this up in our series on Divided America? Because when people work hard, they try to be responsible, and yet lose everything because of a sickness or an accident, they feel that the system has let them down. And guess what? I agree. I want to tell you two little stories to illustrate. Maybe you have experienced something similar or you know someone who has. I was able to connect with a good best buddy of mine from high school a few years ago. We hadn't seen each other but a couple of times in 40 years. He was part of the middle of society, though he wasn't particularly well off. He had never been able to buy a house. He'd worked as a painter and was between construction jobs when he felt a pain in his chest. It really hurt, so he wound up going to the hospital. He was admitted. He was uninsured. Thankfully, he survived what they told him was a mild heart attack. He spent 3 days in an intensive care unit, and then he was discharged and he went home with prescription medications that he's still on as far as I know. Within a month, the bills started to come in. He owed and this was about 10 years ago. 3 days in the intensive care. He appealed to the hospital, and they said they could work out a low interest, payment plan for him. They said, if you just pay $1,000 a month, you can pay this off in just 9 short years. Well, he was understandably devastated. He told me at first he cried, and then he laughed because he didn't own anything. After much back and forth, the hospital actually wrote off much of the cost. He paid what he could, which was several thousands of dollars, but he narrowly avoided bankruptcy. I wonder how many others out there have lived out this scenario. My second story is about another country, Australia. Australia has a national healthcare system by which the Australian government is the leading healthcare provider. There are all kinds of opportunities for buying elective services, like plastic surgery or, various things outside of basic healthcare. Well, a few years ago, I traveled to Australia to participate in my daughter's wedding. I was scheduled to sing a song as part of the ceremony, and I was very excited about that. But the week before, I got a terrible sore throat. Traveling on the airplane, I probably got a bug from somebody. My voice got raspy. My daughter said, "Dad, we have to take you to the clinic." I was seen by a doctor just a few minutes after I got there. She diagnosed me with some bug and gave me a shot. And she said, you're going to be okay. You're going to be able to sing in a week. But she said, "I'm sorry, but I have to charge you $30. And of course, I shrugged my shoulder. I was very happy. And I said, "Will you be billing the balance to my insurance back in the States?" Here's what she said. She said, "Oh, God, no. We don't even have a cash drawer. We don't know what to do with your $30. We don't usually take cash from anybody. But you're not a citizen, and this is what the rules say." And so we both laughed. And for me, it was the best $30 I ever spent. My older daughter, who had given birth there a couple of times, reminded me, she said, "Dad, I've had 2 babies here. We never even talked about money. My portion just comes out of my paycheck, and I never have to worry." By the way, I sang, she was married, all is well. Imagine a healthcare system that covers everyone and no one goes bankrupt due to illness. No one just stays home or doesn't get medicine just because they're afraid of the cost. No one chooses between food and healthcare. No one worries about the cost of staying alive. The buzzwords among many in America today are "Make America Great Again." And I've always thought America was great, but I do like the words that are in the preamble of the U.S. Constitution that describe part of the framers' motives, namely, to form a more perfect union. I like that. In my view, one of the ways we could do better is to do the difficult work to change our healthcare system, providing instead universal health care. I could go on and on about how Americans pay much higher percentage of their income on health care, but are not necessarily better, healthier folks than in many other countries. I'll read one short excerpt from a study from a Commonwealth fund which did an extensive survey on healthcare worldwide. Here's what they said. Remarkably, a high-income person in the U.S. was more likely to report financial barriers to health care than a low-income person in nearly all the other countries surveyed: Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, and the United Kingdom. Norway, the Netherlands, Australia were the top performers overall. In the middle of the pack were the UK, Germany, New Zealand, Sweden, and France. Switzerland and Canada ranked lower than those countries, although both still perform much better than the United States. Among the 11 nations surveyed, the U.S. is the only one without universal health insurance coverage. Again, I think we can do better. If we could find our way to relieve the tension that healthcare costs places on our hardworking Americans, I think our nation's temperature would actually go down. Think it over. As always, I value your feedback. Thanks for watching. I'm Tim Hockett. Hey, before you go, I want you to know that I value your thoughts and your questions. I do have 3 favors to ask. First, please subscribe to this channel, America Divided, We Can Do Better. 2, make time to watch all these little videos. And 3, please share these videos widely. Together we really can make a difference. I hope you have a great day.